Have you ever wondered how a simple glance from your doctor could reveal hidden health risks in your daily routine? What if the hygiene habits you think are harmless are silently signaling deeper problems in your body? And here's the most important question. Are these mistakes quietly stealing your health without you even realizing it? In this video, we'll uncover 7 critical personal hygiene mistakes elderly often make. Mistakes doctors notice immediately, and that could endanger your well-being or the health of someone you love. These aren't just grooming tips. They're life-saving insights that can help you thrive in your golden years instead of facing preventable conditions that rob you of independence. Stay with me until the end, because even small changes today can protect your future. Before we begin, I'd truly appreciate your support. If you haven't subscribed yet, please do so and turn on the bell so you never miss a video. And if you find this lesson helpful, leave a comment below. I'd love to hear from you. Now, let's get started. Mistake number 1, neglecting oral hygiene. When was the last time you really looked at your toothbrush? Are the bristles frayed and splayed like an old broom, barely doing their job? Do you brush thoroughly for 2 full minutes, morning and night, or do you rush through, barely skimming the surface? And here's the even more pressing question. Are you flossing every night without fail, or do days and weeks slip by without a second thought? More importantly, did you know poor oral hygiene goes far beyond bad breath or the occasional cavity? It's not just about your smile, it's about your life. Research from geriatric specialists at Harvard Medical School uncovered a sobering truth. The bacteria thriving in untreated gum disease don't stay in your mouth. They can slip into your bloodstream, travel through the body, and damage vital organs, directly contributing to heart disease, stroke, and even dementia. Seniors who neglect oral care are 3 times more likely to develop serious cardiovascular problems compared to those with consistent dental habits. That's not a small statistic. It's a wake-up call. Take Sylvia's story as an example. At 68, she was a retired school teacher in Oregon, active, independent, and passionate about gardening. For months, she ignored the blood on her toothbrush, dismissing swollen gums as a normal part of aging. "I thought it was normal," she admitted with regret. But during a routine checkup, her cardiologist discovered dangerous inflammation in her heart valves. Tests revealed the cause. Oral bacteria from neglected gums had quietly traveled through her bloodstream, attacking her heart. Her doctor was blunt. A few more months and the damage might have been irreversible, potentially a fatal heart attack or stroke. Sylvia's story isn't rare. It's a warning for anyone ignoring the signs in their mouth. So what can you do now? Inspect your toothbrush. Hold it to the light. Are the bristles splayed in every direction? If it's over 3 months old or looks worn, replace it today. Better yet, consider an electric brush. Studies from the University of Pennsylvania Dental School show electric models remove about 62% more plaque than manual brushing, giving teeth and gums a real advantage. Commit to brushing twice daily and set a timer for 2 full minutes so you don't cut corners. Floss every night, no excuses, to clear what a brush can't reach. And keep your dental checkups, even if you wear dentures. Your gums still need professional care. Take a moment to reflect. Do you see bleeding when you brush? Are your gums puffy, red, or tender? These aren't minor annoyances or just aging. They're signals your mouth needs attention. Those bleeding gums and swollen tissues are distress signals from your body, urging you to take action. Don't ignore them. Your heart, your brain, and your overall well-being depend on it. Mistake number 2, infrequent bathing and poor skin care. Let's be honest. How often are you stepping into the shower or tub? Once or twice a week, thinking it's enough because you're less active now, or because winter air leaves your skin dry. Here's what many overlook. Your skin isn't just a shell. It's your body's largest organ, a living barrier that often reveals early signs of internal health issues long before other symptoms appear. Dermatologists at the Mayo Clinic warn that when seniors cut back on bathing, they don't just risk surface dirt. they may also hide early signs of conditions like diabetes, liver disease, or heart problems. In fact, their research shows nearly 40% of undiagnosed medical issues in older adults could have been detected earlier if skin changes were noticed through proper hygiene. Consider Clarence, a 77-year-old retired postal worker from Michigan. A practical man, he thought bathing once a week was enough, especially during the cold winters when his skin felt tight and dry. "I didn't want to make it worse," he explained. But during a routine checkup for a lingering cough, his doctor noticed unusual patches of discoloration on his arms and legs, changes that didn't look like normal dry skin. Concerned, the doctor ordered tests, and the results were shocking. Clarence's diagnosis was early-stage kidney disease. The infrequent bathing hadn't caused it, but it had hidden a key symptom, subtle skin changes that might have warned him weeks, even months earlier. His wake-up call came just in time, but he often wonders how long it might have gone unnoticed without that routine appointment. So how can you take charge of your skin's health? Start with a consistent bathing schedule, at least 3 times a week, even if you're not leaving the house or breaking a sweat. Use a gentle, fragrance-free soap to cleanse without stripping away natural oils, which already decline with age. After bathing, while your skin is still slightly damp, apply a moisturizer with ingredients like hyaluronic acid or glycerin to lock in hydration and keep it supple. And don't stop there. Make it a habit to check your skin from head to toe. Do you notice patches that stay dry and scaly? Unexplained discoloration, yellowing, redness, or dark spots? Persistent itching or areas that feel different to the touch aren't cosmetic quirks. They're your body's way of sending an alarm. Don't ignore it. Schedule a checkup if anything seems unusual. Your skin is speaking to you. The question is, are you listening? Mistake number 3, ignoring nail care. Take a moment and look at your hands and feet. Are your nails neatly trimmed, clean, and healthy in color and texture? Or are they ragged, yellowing, or thickened, hidden away in socks or gloves because you'd rather not deal with them? Many assume nail care is a small detail, maybe even vanity, but that's far from true. Your nails act like a health dashboard, giving doctors insight into your body's condition. The American Academy of Dermatology stresses that changes in nail appearance can signal more than 20 systemic diseases, including anemia, thyroid disorders, and heart conditions. Their data is striking. In patients over 65, nearly 30% of nail abnormalities have led doctors to uncover serious, previously undetected health issues. Beatrice's story proves this point. At 82, she was vibrant, living independently in Ohio, and still knitting scarves for her grandchildren each winter. But her toenails grew thick and yellow. Embarrassed, she swapped open-toed sandals for closed shoes, dismissing it as a normal part of aging. She didn't worry until sharp foot pain finally forced her to see a podiatrist. The diagnosis was immediate. A fungal infection had taken hold, thriving for months unnoticed. But that wasn't the biggest concern. Further tests revealed Beatrice's immune system was severely compromised, pointing to an underlying condition that required urgent care. She was stunned. "I had no idea my nails could say so much," she admitted. What began as a small cosmetic issue turned into a critical health discovery, one that could have been addressed much earlier. So, what should you do? Start today with a simple nail care routine. Trim your fingernails and toenails regularly. Cut straight across with clean clippers. Then gently round the edges to prevent painful ingrown nails. Always keep them clean and dry. After washing, pat them thoroughly to avoid trapped moisture. Choose breathable shoes and change into fresh socks daily to keep your feet healthy. Most importantly, don't dismiss nail changes as just old age. Are they brittle, splitting, turning yellow or brown, or unusually thick and ridged? These are not trivial quirks. They are potential red flags your body is sending, signals that deserve medical attention. If you notice anything unusual, call your doctor. Your nails are speaking. Make sure you're listening. Mistake number 4. Improper incontinence management. This is a topic many avoid out of embarrassment, but it's far too important to ignore. More than half of seniors experience some form of bladder or bowel control issue, yet too many suffer in silence, hiding it out of shame instead of seeking help. The consequences are serious. Experts at Johns Hopkins Medicine warn that untreated incontinence not only causes discomfort, but also leads to skin infections, increases the risk of falls, fuels social isolation, and may even mask life-threatening conditions like bladder or prostate cancer. Research shows seniors who address incontinence properly face 60% fewer complications than those who ignore it. Take Douglas, a 73-year-old retired accountant from Arizona. Proud and independent, he was devastated when he noticed occasional leakage. Embarrassed to admit it, he tried to manage on his own, stuffing paper towels into his underwear and changing clothes several times a day. But after months of this, painful sores developed on his skin, leaving him no choice but to see a doctor. His urologist didn't just treat the sores. Tests revealed an advanced prostate condition that had been silently progressing. "My pride almost killed me," Douglas admitted with regret. "If I'd spoken up at the first leak, things could have been very different." His story isn't rare. It's a warning many need to hear. First, set aside embarrassment. Your doctor has seen it all before and is there to help, not to judge. Make an appointment to discuss any leakage, no matter how minor it seems. In the meantime, avoid makeshift fixes like tissues or towels. Instead, use absorbent products designed for incontinence, available at any pharmacy. Change them promptly when wet and protect your skin with a gentle cleansing routine using mild soap and water. Most importantly, remember this: incontinence is not an unavoidable part of aging. It is often a sign of something treatable, from a simple infection to a more serious condition. Are you noticing dampness, planning your day around bathroom stops, or even avoiding outings altogether? Don't ignore it. Your dignity, your health, and possibly your life depend on timely action. Mistake 5. Ear hygiene errors. Be honest. What's your ear cleaning habit like? Do you reach for a cotton swab after every shower, pushing it deep into the ear canal to dig out wax? If so, you're not alone. But it's a dangerous mistake many seniors make. Improper ear cleaning doesn't just threaten hearing, it can mask infections and even cause lasting damage. Ear, nose, and throat specialists report that nearly 40% of ear canal injuries in adults over 65 come from misguided cleaning attempts, often leading to painful infections that could have been completely avoided with better habits. Patricia's story is a powerful reminder. A 71-year-old retired librarian from Washington, she cherished her quiet life surrounded by books. For years, she used cotton swabs deep inside her ears, convinced she was keeping them clean. "It's what I'd always done," she explained, puzzled when the trouble began. One day, she pushed too far and punctured her eardrum. The infection spread beyond her ear canal, requiring emergency care and leaving her with permanent hearing loss. "No one ever told me it was dangerous," she lamented. What seemed like a routine habit turned into a life-altering injury, one that could have been avoided with the right knowledge. So how do you clean your ears safely? Remember this golden rule. Never insert anything smaller than your elbow into your ear canal. No swabs, no hairpins, nothing. Instead, gently wipe the outer ear with a warm, damp washcloth to remove visible wax or dirt. If you suspect excess buildup, maybe your ears feel clogged or your hearing seems muffled, use over-the-counter drops designed to soften wax, following directions carefully. And if you notice pain, discharge, or sudden hearing changes, don't try to fix it yourself. See a professional right away. Are your ears itchy or unusually full? Has your hearing started to fade? These aren't problems for a cotton swab. They're signals calling for expert care. Your ears are delicate and irreplaceable. Treat them with the respect they deserve. Mistake 6. Poor foot hygiene. When was the last time you really paid attention to your feet? Not just a quick glance in the shower or while pulling on socks, but a careful look at every inch. The spaces between your toes, the condition of your heels, the texture of your soles. When did you last check them closely? Your feet aren't just the foundation that carries you each day. They are windows into your overall health, revealing critical clues about your circulatory and nervous systems that doctors watch closely, especially in older adults. According to podiatrists at the American Podiatric Medical Association, poor foot hygiene is often the first warning sign of serious conditions like diabetes, peripheral neuropathy, or vascular disease. The numbers are eye-opening. APMA research shows that in adults over 65, consistent foot care and self-inspection could prevent up to 85% of diabetes-related amputations. Imagine that. 85% of cases where people lose toes, feet, or even legs could be avoided with something as simple as proper foot hygiene. This isn't about vanity or simple grooming. It's about protecting your mobility, independence, and overall quality of life. Take the story of Raymond, a 76-year-old retired factory worker from Illinois. For years, he ignored the dry, cracked skin and small cuts on his feet, dismissing them as just the wear and tear of aging. "My feet had looked rough for as long as I could remember," he admitted. "I figured it was just part of getting old." But during a routine checkup, his doctor took one look at Raymond's neglected feet and immediately ordered a diabetes test. The result was an early diagnosis, caught at a stage where diet, exercise, and medication could still prevent irreversible damage. Reflecting on it, Raymond confessed, "If my doctor hadn't checked my feet, I might have gone years without knowing. By the time I noticed, I could have lost a foot, or worse." His experience is a powerful reminder that even small oversights can lead to life-changing consequences. So what can you do? Start by making foot care a daily habit. Wash thoroughly with soap and warm water, paying special attention between the toes where moisture tends to linger. After washing, dry your feet completely, leaving no dampness that could invite infection. Set aside a few minutes each week for a close inspection. Look for cuts, sores, blisters, or changes in color or temperature. Finally, wear clean, dry socks made of natural fibers like cotton or wool, or choose moisture-wicking blends to keep sweat under control. If you notice dry, cracked skin on your heels or soles, use a fragrance-free moisturizer, but avoid applying it between your toes where trapped moisture can cause infection. Most importantly, never ignore persistent pain, numbness, tingling, or wounds that refuse to heal. These are not minor annoyances. They can be early warning signs of serious conditions like nerve damage or poor circulation. Ask yourself, are your feet unusually dry or cracked? Do you see cuts that linger without healing, patches of discoloration, or areas where sensation is fading? Don't dismiss these changes as simply aging. They demand immediate attention from a healthcare professional. Mistake 7. Medication-related hygiene issues. If you're taking multiple prescriptions, have you noticed subtle changes in your body since starting them? Maybe a shift in body odor, unusual sweating, or a constant dryness in your mouth? It's tempting to brush these off as quirks of aging, but the very drugs protecting your health might also be triggering hygiene problems that point to harmful side effects. Pharmacologists at the American Geriatric Society have shown that many common prescriptions, like blood pressure medications, antidepressants, and cholesterol-lowering drugs, can cause dry mouth, excessive sweating, or even changes in body odor. These signals may not just be bothersome. They can point to toxicity or other adverse reactions your body can't afford to ignore. Data from the American Geriatric Society shows that nearly 40% of medication-related side effects in seniors first appear as changes in personal hygiene. These subtle shifts often show up long before more obvious symptoms like dizziness or fatigue. Take Barbara, a 67-year-old retired nurse from Florida. For months, She struggled with an unusual body odor that clung to her despite showering daily, using deodorant, and even switching soaps. Her family teased her, assuming she had simply let her standards slip. "I was doing everything right," she explained. "I couldn't understand why I still smelled off." It wasn't until a visit to her geriatrician that the truth came out. The odor wasn't poor hygiene at all. It was a side effect of a medication quietly stressing her liver. Blood tests confirmed early signs of toxicity, and with a quick change in her prescription, Barbara avoided serious organ damage. "I never imagined the smell was coming from inside my body," she admitted. "I thought I was just getting sloppy with age." So how can you protect yourself from the same mistake? Stay alert to your body's signals, especially after starting a new prescription. Keep a simple journal, whether in a notebook or an app on your phone, and note any changes you observe. A new odor that lingers despite bathing, unusual sweating even in cool weather, a parched mouth that water can't relieve, or skin changes like persistent dryness or rashes. These may be early warnings your body is trying to send. Hydration is essential. Drink enough water each day unless your doctor advises otherwise. If you notice persistent changes, like unexplained sweating, a strange odor, or a mouth that feels dry and sticky, don't delay in calling your doctor. These could be early warnings of drug interactions or toxicity that require prompt evaluation. And remember this vital rule: never adjust your medication dosage on your own, even if you suspect it's the cause of these hygiene changes. Only a qualified healthcare provider can safely make those decisions. Take a moment to reflect. Have you noticed body odor that lingers despite daily showers, excessive sweating, or a mouth that stays parched no matter how much water you drink? These are not just minor inconveniences or signs of aging. They may be your body's way of signaling a serious problem that deserves urgent medical attention. So there you have it. 7 critical hygiene mistakes doctors often notice in elderly patients, along with simple, practical steps that can protect your health and even save your life. Now, I'd love to hear from you. Share one thing you've learned today that you'll start applying in your daily routine. It might be replacing an old toothbrush, checking your feet more often, or finally bringing up a concern with your doctor. Your experience might inspire someone else to make a positive change. Wishing you good health, happiness, and peace. And don't forget to subscribe to my channel Healthy Aging Blueprint for more life-saving insights.